how membership has improved patient safety or the quality of care that you deliver?
Well, I think through Quality Health Network, the Ottawa Hospital has been able to develop capacity to improve around many processes and improve our patients' outcome. And we've done that through the forums, attending there and learning new strategies. It's been a very effective way to have several people go to a course or a conference, develop the improvement technique, and bring it back and spread that through the organization. So it's been very effective for us.
Can you tell me how a quality improvement initiative has had a direct impact on the patients that you serve here?
Well, at one of the conferences at the forum, I had an excellent presentation on metrics for an MAC, and as a physician, sometimes putting together that dashboard for physicians about aspects of care that they should follow has been quite difficult, and that gave me a very practical tool to talk about it with others in the organization, to look at what we should measure at our medical advisory committee, and that allows us to aim to improve on all of those measures, whether they be HSMR or surgical wound infections, whatever it is.
What is the advantage of this being a voluntary organization?
I think voluntary organizations really are characterized by committed people and committed organizations. And I think that's the real strength of the organization. People aren't forced to, they join because they've got a common cause, they've got a common outlook. In this case, it's improving quality in healthcare. And it goes past providing dues just to be a member. I think it talks about sharing and giving of your knowledge to the others in the network, just as you receive knowledge and guidance from them as well. So it's mutually beneficial.
What compelled you to be on the board of the Quality Healthcare Network?
Well, I see the Quality Health Network as really the only sort of grassroots organization that really speaks to quality within the whole province of Ontario. And as such, I think it brings all of the constituents together, whether it's hospitals, community care access centres, all of varieties. We even have other organisations such as the Army, our Canadian Armed Forces that are members. So it brings people together, and I think being in a position to support those people, to bring the ideas that you see from all across the province, and really to push the quality agenda. I think it's a very important aspect of being on a board, is to set the strategy, and the strategy should be to improve the quality of healthcare, and also done on a voluntary basis where we try and strive and help each other get better. So I think it's a very important cause and a very important board. You know, the majority of the people, I know some at my level, but a lot of them basically quality improvement coordinators. They work more at the coalface, they work with the teams. And I think that you're quite right, it is a network where people are often very similar stages, very similar problems are able to share, which is really what all those associations with emergency physicians or interns or surgeons, I mean, they're sharing common